I'm Steve Kosser. I'm a licensed psychologist and a certified school psychologist in Pennsylvania. I've worked with children on the autism spectrum for 30 years, and I've especially specialized in Medicaid as a source of funding for that work. Medicaid has a little-known program within a program called EPSDT, Early and Periodic Screening, Diagnosis, and Treatment, which provides an avenue for funding for durable medical equipment, eyeglasses, OT/PT speech, and behavioral health rehabilitation services in all 50 states. Nobody knows that that exists, and I do, and I've been using it for the past 16 years to fund treatment, 20, 30, even 40 or more hours of one-to-one treatment where the staff accompany a child to the school, to the home, day in and day out, week after week, month after month, year after year, at absolutely no cost to parents, regardless of family income.
So how does a parent find out? How do they inquire? What are the requirements? How?
According to federal law, Medicaid exists in all 50 states, and so does the EPSDT program. States had the option to implement what is called the rehabilitation option, and all 50 states did implement that, have implemented it by now. So that means that all of the benefits I just described are available in all 50 states. Parents need to say, I would like to obtain EPSDT benefits for my child. It's a very simple process. You go to a licensed practitioner of the healing arts in that state who is enrolled in the Medicaid program. That practitioner, and licensed physician is certainly allowed, but also in most states a psychologist is allowed. A lot of states, a licensed clinical social worker is considered a licensed practitioner of the healing arts, and they can prescribe EPSDT benefits. So you take the child to an enrolled provider, they do the evaluation, they say the child has autism or PDD or ADHD, whatever the disability is, and they prescribe behavioral health rehabilitation services exactly as I've implemented them in Pennsylvania, and that is with a professional taking responsibility for the program, a licensed professional who creates a written treatment program that follows a developmental practice or paradigm if the child has a developmental disability, so that you know exactly what's going to happen each step of the way. And finally, you take outcome data from the parents measuring their perception of their child's progress every single week. And through that process, with those three components, you produce a record of treatment effectiveness. So the bottom line is the doctor prescribes that program. The parent takes that prescription to the state Medicaid authority and says, this is what I want. The state Medicaid authority says, we don't do that here. They have now violated the civil rights of the child because it's part of the Social Security Act. It's a civil right in America to obtain treatment that is sufficient. This is federal law. Sufficient in amount, scope, and duration to reasonably achieve the intention of the prescriber. Federal law. I have 16 years worth of data that says that 20 hours or 30 or whatever is effective for a child of the same age, same gender, same diagnosis. I have 15 or 20 examples of it. The parents can access that data through treatmentplans.worked.com, the treatment plan that worked, and the data that shows that it was effective. They get all that, and they package that and say, you're violating my kid's civil rights because this is not an experimental procedure. It's 16 years of data. In 2001, the National Academy of Sciences, one of the most prestigious research bodies in the world, issued a report called Educating Children with Autism. And by the way, the title Educating Children with Autism is simply a function of the fact that the Department of Education paid for it. I talked to the director of the study, and he said, hey, look, the piper, who pays the piper calls the tune, and that's why we called it Educating Children with Autism instead of Treating Children with Autism, because it's a compilation of 11 different treatment modalities, floor time, verbal behavior, etc. So they analyzed these different models, and they came to the conclusion that if a child doesn't receive at least 25 hours of intensive individualized treatment, they don't have a reasonable probability of abating the symptoms of autism. So you have that national research study, and you have my 16 years worth of data showing that these behavioral treatment plans significantly reduce physical aggression, communication deficits, socialization deficits, non-compliance with prompts, and safety problems. We know this treatment model works. So if the local practitioner prescribes the treatment model I developed, and we back it up with the data, and the parent takes it to the local state Medicaid authority and says, fund this under EPSDT, if the state says no, the local disability rights network, the health law projects, all the agencies that can protect against people with disabilities failing to get their rights can rise to the occasion, use the data, use the background, and win. That's exactly what happened in Pennsylvania in 1992. We fought it, and now everybody says, God, I wish I lived in Pennsylvania, 30 hours a week, what could happen? The bottom line is, if one of my staff is with your kid 30 hours a week, how could he possibly stay the same? He's got to get better as we're relentlessly correcting him.
How does this differ from, states that have like children's waivers? I mean, you're saying this is a completely different entity of the Medicaid system?
Here's the example I used for one of the reporters this week. You have a couple of different things. This is Medicaid. This is EPSDT. It's a wallet full of credit cards. This is what you need. Instead, they create waivers for you. This is a package of breath mints. And they say, here's what we have for you. Look, here, this is the waiver. Look, this is what you need. And all the while, this exists. But they don't tell you about it because they want you to take this benefit and be thankful. That's literally what they're doing with waivers. Waivers are temporary Band-Aids on arterial bleeding. What you need to do is stop messing around with trying to force the private insurance companies, Blue Cross, Blue Shield. Their pockets are miles deep. Those people can bring any kind of political pressure to make you lose. Medicaid is a federal entitlement. You have the force of the U.S. government backing up your right as a disabled person to treatment that is sufficient in amount, scope, and duration to reasonably achieve the purpose of the prescriber.
How about limitations? Is this just for a certain age group or certain type of disability?
Birth to 21. EPSDT covers birth to 21 and whatever disability is identified in the Social Security Administration's Blue Book of Disabilities, one of which is autism, and the whole range of autistic spectrum disorders.
So a parent, in order to do this, because it seems like there's every state works a little bit differently. You might have a PASS agency or a regional center.
Right.
You're saying that they find a healing arts.
Every one of those agencies is an agent to obstruct getting at the credit card folio. They exist because Medicaid is a cooperative effort between the federal government and the state government. In some states, the feds provide 75%, the state's got to pony up 25%. They don't want to do it. In some states, it's at least a 50-50 split. They don't want to do it. The feds are saying, we want to do this. In fact, it was a knockdown, drag-out fight until 1989. This program was founded in 1967, and it wasn't until 1989 that Congress said, stop it. This is a mandatory part of every state's Medicaid program. If you don't implement it, and that is EPSDT, whether or not it's part of a state's plan, this benefit is available. And finally, the states rolled over and said, okay, fine, we'll do it. And that's when Pennsylvania implemented Medicaid, and they actually went even farther. In 1988, the federal government made it possible for states to implement a more relaxed criteria for Medicaid eligibility. So now in states like Pennsylvania, and there were 37 of them at least, you don't have to be poor to get Medicaid. If you're disabled and you have 2 Ferraris in the garage, or rather your parents have 2 Ferraris, it doesn't matter what they have. It matters that you're disabled. And in every state, it doesn't matter what the assets are in the family anyway. They look at the child's income. How much does a 4-year-old make? They qualify under the federal poverty and they get Medicaid. They get Medicaid if they're disabled in 37 states. So the bottom line is, in the vast majority of circumstances, unless a kid has a phenomenal trust account, okay, which is something that's a separate deal entirely, if you have a trust account set up for your child, it may have been a mistake because you don't want to have your child not qualify for Medicaid. But in the vast majority of circumstances, the child with a disability qualifies for Medicaid, is entitled to EPSDT benefits that are sufficient in amount, scope, and duration to achieve the intended purpose of the practitioner. You have 16 years worth of outcome data that proves that the behavioral programs work. You have everything you need to go to the Medicaid agency and say, give me what I'm entitled to. And if they say no, they're violating civil rights. They're jeopardizing the state's Medicaid program because they're violating EPSDT.
So they write a letter, if that.
Parents write a letter. They get a state senator, congressman, any of the people who are involved in advocating for children's rights. Once they realize this exists, that state's going to roll over just like Pennsylvania did in '92. But every state has to fight that battle. And frankly, parents of children with autism are up for it. They may be the only group that is so well organized, so well connected, so networked. Parents of children with autism can lead this battle and win the privileges that the kids in Pennsylvania have.
Are you suggesting that this is an individual battle, or do you think there needs to be some organization amongst the parents?
You're always better if you have numbers, strength in numbers, goes without saying. But if it's applicable to one child, it's applicable to all children with disabilities. That's a given. So how hard is it to put a coalition together of parents who say, yeah, me too? And the other thing to realize is I'm not advocating the wholesale raiding of Medicaid. Medicaid has limited funding. And when you find out how much is being raided by school districts, it's an absolute scandal. School districts can tap Medicaid to take money from the Medicaid fund to reimburse them for the cost of providing the services that the local taxpayers are already paying for. The money comes out of Medicaid in a back door. If, for example, a guidance counselor gets $40 an hour, plus benefits, plus all the perks that they get, they can send a bill to Medicaid. The school district can then extract that money and use it to pay for training experiences, perks to Vegas, whatever. You know, it's obscene.
But the parents would have to give the Medicaid information to the school, so that would probably be...
No, they don't.
They
all the parents have to do is sign a paper, and that gives the school permission to tap Medicaid. So that's a problem. And by restricting that pipe a little bit, you can fund the in-home and in-community services that I'm describing.
That's not double dipping, though.
It's not double dipping because the schools tap one part of Medicaid
and
you're tapping a different part.
What about parents that already have something like the children's waiver? Is there still the entitlement, or is it one or the other?
A waiver is the cheap breath mint excuse for the credit cards. Just because you signed up for a waiver does not void your entitlement to the credit card folio. My suggestion is parents should not be pursuing private insurance funding for what they're entitled to under Medicaid. They should lobby to have a more equitable distribution of school-based funds, siphon a little more off, a little less to the school, a little more to themselves, have some more equity there, but also if the treatment program is supervised by a licensed professional who takes responsibility for it, and it's produced in a written treatment plan that has the developmental progression, and if outcome data is taken from parents that shows progress, if those three criteria are met, you're going to keep the unscrupulous carpetbaggers out of the system because they don't want to do that. They just want to gouge with both hands and run. So if you have those criteria for performance, those standards, as a criteria for the Medicaid regulations that will have to be passed in each state, that's not really hard to do. Those are reasonable safeguards against fraud.
But you have, like, say we have a physician here that, accepts Medicaid. You hear that sometimes. It seems like there's a lot of providers that will say they don't accept Medicaid.
The reason they don't accept it is because Medicaid provides a small amount of funding. But the critical thing about the EPSDT regulations is that they allow a physician to supervise the delivery of services by others. So that in my practice in Pennsylvania, I supervise a small number of master's level unlicensed people. They in turn supervise up to 9 bachelor's level people who are rendering 10, 20, 30, 40 hours of service a week. Each one of those people trickles up and I have a piece of whatever they're making. So my investment of time is relatively small. My income is relatively large, but of course I pay them health care expenses and I pay them a decent living wage. Bachelor's degree, $17 an hour with health insurance fresh out of college. As they get more experience, they go back to graduate school and they still work at that rate. When they get their master's degree, they work for me as mobile therapists or behavior specialists at $25 to $35 an hour. And when they get licensed, they can join the group and be a psychologist at $50. The licensed person at the top is fundamentally responsible for the performance of the pyramid. So if this person makes a mistake, I'm on the hook for it. So I make absolutely certain that everybody's getting supervised, everybody's getting trained, and because the parents are giving me feedback about the adequacy of the training program every week, nothing languishes. We don't have spectators providing treatment. They're active, they're effective, and the parents are ecstatically happy with the progress. For nothing, costs nothing, because it's EPSDT and it is available everywhere. Nobody knows about this. I do, and I know more than anybody I know about it. And I'm trying to make this message get out to as wide an audience as possible, because if the battle's fought in Arizona or Tennessee, these programs can be established. Not me working it, for crying out loud, I can't be everywhere, but the model I created can be implemented by any licensed practitioner of the healing arts. Start in your garage like I did. You know, in a year, 2 years, the word gets out and pretty soon you can quit your day job and just do this, which is exactly what I did.
Is there a place where people can find more information? Do you have a website or?
www.IBC, Institute for Behavior Change, IBC dash like a minus sign, P as in Paul, A as in Apple.org, IBC-PA.org. We also have www.treatmentplans.thatworked, all one word, thatworked.com, where you can download more than 500 treatment plans with the data. And the best part is the newest thing is ourcasemanager.pro, where people can get my direct case management assistance to set up these programs anywhere in the world.